Well, at 10 o'clock today is World Ovarian Cancer Day, and the fight to detect this so-called silent disease is getting a major boost. Joining us is Audra Moran. She is the president and CEO of Ovarian Cancer Research Alliance. Audra, thanks for joining us here this morning.
Thank you so much for having me.
So often referred to as the silent disease, can you explain why it's so hard to detect?
Yes, there's no screening test for ovarian cancer, and the symptoms are incredibly vague. I mean, things like bloating, pelvic pain, feeling full quickly. These are things a lot of women experience, almost every month. But if they're persistent, we of course encourage people to be checked and talk with your doctor. But I think that's definitely one of the reasons. Many people believe that the Pap smear tests for ovarian cancer, and it doesn't. There is no screening test. So, we're obviously we're funding research and we're trying to find something. But at this point in time, it's really, paying attention to your body and talking to your doctor.
So then many women may not realize they're at risk if we see these symptoms over and over again. What are the kinds of conversations that we should be having then, or they with our doctors?
That's actually the exactly right question. You should think about risk. That's really what we encourage people to do. Understanding personal risk is key. Ovarian cancer has a genetic component, so approximately 20% of ovarian cancers are from mutations like BRCA1 or BRCA2. So knowing that can help guide prevention and also treatment if you're diagnosed. Family history matters as well. So knowing if there's ovarian, breast, uterine, or colon cancer in your family. That's important to talk to your doctor about if you know that there is. And genetic testing is available for those that need it. And OCRA actually offers free testing on our website to those who qualify. So there are options. And then there's also a prevention option for women who aren't planning to have children or beyond their childbearing years. If they're having another pelvic surgery, they can talk to their doctor about having their fallopian tubes removed, because approximately 70-80% of ovarian cancer actually begins in the fallopian tubes, probably more. So it's actually a very low risk surgery if you're having another surgery.
Gotcha. Okay, so you talked about the genetic testing program that you offer. Who should be taking advantage of that? And again, talk about the family history and why you should know about your own family medical history.
Well, it's just so important to know, so that we have a little quiz on our website to see if you're eligible for the free test, and some of the questions they ask are about whether you have any of the cancers I mentioned, which are ovarian, breast, uterine, or colon in your family. If anyone in your family has the BRCA gene, there's a number of things that you would want to think about. And also, talking with your doctor is always key. So if you're concerned, knowing that history can make a real difference, and doctors will, help assess your risk.
And then for anyone who is watching right now and she may be worried, how can she advocate for herself?
It's always about, clear communication, first of all, thinking about, have you had any symptoms, knowing your history, but also any concerns that you have, and sharing that information. It's important to ask questions and trust your instincts, and also get a second opinion if needed. Sometimes doctors can be dismissive of, oh, I think it's just gastrointestinal or whatever. And if you're still concerned, see another doctor. And if diagnosed with ovarian cancer, you should see a gynecologic oncologist.
Today, you're offering and launching something, the Community Accelerated Research Exchange. Walk us through this and why it's such a game changer.
It really is. We're so excited today. We've been working on this a long time. It's a first of its kind, really, global research exchange, and we really think it's going to accelerate breakthroughs in ovarian and all gynecologic cancers. It includes a patient registry for women with ovarian and uterine cancers. That's called the Living Lab, and people can join. It's a secure site. You can upload your electronic health records and take surveys and report your long-term experience. So this actually directly contributes to data and the experiences help drive research forward. The other part is the Discovery Lab. So where the patients are putting data in on one side and the scientists are looking at that data on the other, de-identified. And it's an AI-enabled platform that's powered by Amazon Web Services, and researchers from around the world can securely share their data, collaborate in real time, and uncover insights faster. We really do think that this is a game changer and a very unique approach to research, and can probably apply to other disease areas.
Yeah, I mean, obviously, physicians and patients can better understand with the AI technology component.
Absolutely. I mean, especially researchers, because you're usually working with people that, statisticians and other things, but it's actually designed for researchers who aren't necessarily as computer savvy. So people can go in, put in a data set, keep it private, share it with their collaborators, make it public. I mean, there's a number of options, and it's very user friendly.
The Ovarian Cancer Research Alliance investing more than $140 million in research since '94. Where do you feel we are right now in terms of progress, and what gives you hope?
Well, actually, I mean, what we're doing right now gives so much hope. AI has been such a game changer in the medical research field, and it's had a lot of success in other areas. So we took hope from that when we started designing this more than a year ago. Every day it's changing so fast. The answers are probably not going to come from one lab or one data set. They'll come from bringing patients and researchers and information together in ways that we've never done before. And I think that's true across disease states. So that's really what the Research Exchange is designed to do. And that's what we're really excited about. We really do think it's a game changer.
All right, that sounds good. Audra, anything else we need to know this morning?
Well, if diagnosed, as I mentioned, women should see a gynecologic oncologist, and if OCRA is available with many, many free programs for people with any type of gynecologic cancer. We have patient education, clinical trial navigation. We can pair people with a peer mentor, all kinds of support resources, including for caregivers. And we offer the free genetic testing. Our website is ocrahope.org, and we encourage people to come in and look around.
OCRAhope.org. Audra Moran, President and CEO of the OCRA, we thank you for joining us this morning for this important conversation. Appreciate your time.
Thank you so much.
All right, so we talk about the stats, the science behind that, and that's all great. And behind every number is a real person, a real story. As it turns out, we do not have to look very far, because my colleague here, our assistant news director at WCNC Charlotte, Spencer Collins, has lived this firsthand. Spencer, thanks for taking the time. Be willing to share your story.
Of course, of course.
So take us back to the beginning. When did you first know something was wrong? Tell us about how you discovered you had ovarian cancer.
So my story is pretty weird, unique. Ovarian cancer is talked about being the silent killer because many people don't know they have symptoms. I had no symptoms. I actually was doing fertility treatment to have our second child. Our first is via IVF, so we were getting ready to have a second. Went to my clinic January of last year. They said, all right, baseline testing, all looks good, come back. In February, I came back a month later, and they were like, this is really weird. Your right ovary has doubled in size. Do you feel any pain? I said, nope. You're like, okay, well, we're going to send you to an oncologist just to get it checked. So that was a Thursday. I was out at the oncologist on a Monday. She said, looks really weird, but you're not in pain. You're young, you're healthy, but if you want to be pregnant, we should get this mass out. So we scheduled surgery. And she told me if it's cancer, we'll probably have to remove everything. We will test it when you're in surgery. You can obviously have the option to let us remove everything, or you can, we'll stitch you back up and we'll have that conversation. And so I went into surgery April 2nd of last year, and they took the mass out, tested it. It was unfortunately ovarian cancer. So I had a full hysterectomy, had everything removed, woke up. Thankfully, I had stage 1 ovarian cancer. So I talk about just this weird divine intervention of timing. And had I not gone to do this IVF fertility treatment, I probably would have never known, because again, I was having no symptoms. So I thought everything was normal. Obviously wasn't. So again, cancer is not fun, but I still feel weirdly lucky about how early it was caught, because getting caught at stage 1 is so rare.
So key to getting treatment. And so when you hear those words, again, you are young, no symptoms. How do you process that?
It's weird, and this is going to sound awful. I've always thought at some point in my life I would get cancer. My dad had colon cancer. 2 of my aunts had breast cancer. Now my mom has breast cancer. So it runs in my family. You heard, them talk about like this genetic risk. So I knew I had a very high genetic risk. I just thought it would be when I was older, and I definitely didn't think it would be ovarian cancer. So I'm not a super emotional person. So I think I still am dealing with some of those, because I think you go into it and just say, like, how do I fix it? What do I do? So I was so focused on that, I think, for the first year. And I think now I'm dealing with some of those delayed emotions. But you find really, really good organizations. Like, as much as being in this so-called cancer club is, like, how many people came to love on me, support me, I'm very lucky to live in Charlotte and have, I got treatment over at Atrium with Levine, but I know a ton of people who got treatment at Novant. We just have really, really good systems here. And then I found so many other organizations too. You've had Teal Diva here a couple times. They are gynecological cancer support group organization, nonprofit. So got connected with them. And again, it is not fun to be in a club with these women, but the support that they give and like how much they can teach, and we help each other through, like, oh, well, you're having this symptom, it could be this. Do you talk to your doctor about this? Like, I learned so much from them, and they can help me be an advocate for myself.
And you, by going through your own experience, are able to share, like with us at this moment, share your story, and that helps a lot of folks. Spencer is a pragmatic person, kind of
logic. Forward.
Yes.
Yeah.
And it's fantastic, right? Because
Right.
we work in a newsroom and we need that,
You need that.
structure and guidance and mission and on point.
Right.
But yeah, being in a newsroom and now being on the other, not the other side of it,
Yeah.
but now being one of the stories and one of the topics of it all. And how do you balance, this side of the newsroom, that side of the
You're
newsroom?
also a mother to a young kid
Yeah.
during all of this.
So
Yeah.
the quality and the balance of it all.
Yeah, and again, I think it's somewhat of who I am as a person. I think that living as normal of a life as I could is what helped me, and I just, again, kept thinking with positivity, and I kept thinking, like, again, it was somehow stage one, this weird divine timing, like that really helped me. And again, I really wanted to live life normally for my son. It's a blessing and a curse, I think, that I was diagnosed right before his second birthday, so went through chemo. He didn't really understand what was happening. I think, looking back at it, he could kind of tell something was off, but I didn't have to sit down and have the conversation with him of like, mommy's got cancer and she's sick, but at the same time, him not understanding it, and like the hard days after chemo, I'd be like, I just want to lay in bed, like I can't play with you. But he wouldn't understand that. So it was, again, glad I didn't really have to have that conversation. Again, I'll have it at some point in life with him, and he'll, have to get some genetic testing because I've got 2 mutations that kind of could be the reason I got cancer, or could, just be anything. So he'll go through testing when he's 18, just to see if he's got those mutations. And again, the great thing about that is you can do all this preventative care now. So I've got BRCA2, which, a lot of people think about with breast cancer, but it is ovarian cancer as well. And then I also have something called Lynch syndrome, which again, it doesn't do anything to me now. It's just a kind of like a BRCA mutation, puts me at risk for cancer. So that is colon cancer, pancreatic cancer, ovarian, skin, a couple others. So I'm at, doctor's offices all the time now, just doing now preventative care. And so that's what's nice. It's scary to know you have this risk, but you can take control a little bit more.
What did you learn, or what did you learn now that you wish you knew before your diagnosis?
Ooh.
Because it seemed like you did everything right. You work
Yeah.
out, you eat well, you have a good family work-life balance. So you do all the things right. What else could you have done?
I think it's hard. And so had I gotten genetic testing before, because again, I had 2 aunts, my dad, so like I knew I probably had the risk, but I was like, I don't want to know, like, because I'm gonna live my life. I don't want to,
Right.
do this stuff. And I think I always thought to the extreme of like, oh, you can't live your life. But again, it's just the preventative stuff. So maybe I wish I would have gotten it sooner. It's also interesting when they went in and did the surgery, the doctor also was like, oh yeah, and you also had some endometriosis. I said, what? Because
By the way,
yeah, like you hear about so many women who have this pain and they can't,
right.
Talk about it. But I never really like had a lot of pain ever. So I never would have thought I had endometriosis. Now I do look back and think, oh, like maybe that's why it was so hard for us to get pregnant and stay pregnant. So maybe had like even, when we were doing infertility stuff, pushed a little bit more or did testing to then look and say like, oh, like maybe I shouldn't be having, some of these hormone stuff. But again, like I've always wanted to be a mother, so I don't think that would have changed anything in my life. And again, I do talk about like it possibly saved my life by trying to go have a second
100%
child.
did. Yeah.
Yeah.
Absolutely.
So I just think I am a much bigger proponent for genetic testing now than I was before. So again, I have a younger sister and a younger brother, and said to them like, you need to go get this done. Again, like it doesn't mean you have to, take drastic measures, but it's just knowledge. And I think that's what's super important.
We're watching one of your posts on
You're ringing the bell.
with the fam, and so he still doesn't understand what you went through, I'm sure, right?
No.
You still we're just playing and being business as usual.
Exactly. Yeah, it doesn't really understand. It's funny. The hardest part for me was the hair. I loved my hair, and then I was really nervous about him, so I think I wore a wig or something around the house for the first week, and then I was like, gosh, I can't do this around my house. So like showing him me without my hair, but he like thought it was so cool and like didn't really care. So like that helped me. He would like put on my wig sometimes or whatever, but then it was funny because he would like to take it off, and then there were a couple times he tried grabbing my husband's hair, and we're like, nope, daddy's hair stays on. His doesn't come off.
It's kind of like the joys of having
kids,
like they just think like
the
mommy
innocence
likes
of
to
the
change
kids.
your hair.
Yeah,
Like, mommy likes
yeah.
to change it up. Like
Right.
you don't think any different.
That's why I said it was easy in the sense of like I didn't really have to explain things. Now looking back, I do think that he knew something was going on.
Probably couldn't express how he
Exactly,
feels.
and was like, mommy's not totally the same, but like she's still here every day.
Right.
She still does play with me. So,
Yeah.
but yeah, I think having him too also just helped me get through it because like I was living for him.
Yeah, absolutely. And so, how are you today?
I'm good. So I see my doctor every 3 months just for a quick exam and do blood work. I had my appointment yesterday. All is clear. All
Very
is
good.
good. So I will see her again in August. Yep. And then I do, again, other things for my BRCA mutation. So I'll have a mammogram next month. I'll see a go to the breast clinic in June just for a checkup. Had a colonoscopy in January.
Good.
So all the things, but again, very preventative, and that's what I like is there's, a way to just be checked and looked at regularly. So again, if God forbid my cancer comes back or any other type of cancer comes, like it would be caught very early, and that's so key to catching it early, and treatment is so much, I think, better and works better if once it's caught early.
Yeah, it's that almost that third stage of medicine where it's not only treat when you get diagnosed, but it's preventative and getting way ahead of what the
Yeah.
things could do in the future. Anything else? If there's a woman out there, your message to them?
Get checked, advocate for yourself. I think that we're learning more about how women were not included in so many tests and treatment and studies, and women's healthcare is just different. So really be an advocate for yourself, get second opinions, find someone, a doctor who feels like you really are listened to all the time, find support groups, learn. I remember a lot of times, again, I joined Facebook groups or were talking to people, and I would come in with all these questions, and my doctor would be like, "Wow, you've done your research." And I'm like, "Yes, because I need to know what to ask. Like,
Right.
I don't know what I don't know, so like
Right.
I need to find the things." And yes, it can kind of be scary to learn all of these things, but it can help you ask the questions, and again, be your biggest advocate, because that you got to fight for yourself.
Absolutely. Yeah, I say that all the time. Shout out to Carlene Bragg, part of Spencer's support
Yes,
system
yes, yes.
here in the studio.
Very, very proud of you. I wanted to ask you, because I asked Shannon about this when with Teal Diva when she was here, about these kind of gynecologic cancers are kind of, I would say, hush hush kind of thing. Like they're kind of a bit quieter on the national
Yeah.
conversation.
Yeah.
What can we do? What can friends do? What can women do to help bring that conversation up?
I think have conversations like this.
Right.
Yeah.
Just open discussions in long
It
form.
just feels
Yeah.
like it's just not.
Got to keep on putting
it's
it
not
out there.
as discussed as some other cancers.
Yeah, and I think breast cancer is discussed more just because,
Yes.
again, that risk is 1 in 8. So it's
Right.
much higher. Like, more women are going to get breast cancer statistically than ovarian, uterine, vulva. But again, conversations like this, helping fund, so OCRA, the Teal Diva, just having the conversations, and that's the one thing that I've wanted to do from this is like, how do you take the bad and turn it into something good and advocate? And it's hard for me too, because sometimes people will talk about these symptoms, and I don't want to scare people, but now I'm like, okay, like I've learned what the symptoms are. Yes, didn't have any, and then it's funny because once I was told this could be a possibility, I did start having symptoms that I could realize. But they were so, like, I just felt full.
Which
Earlier.
So do all of us.
Like,
Yeah.
exactly.
Felt full last night.
Especially with women. Like, I didn't eat as much. But then when I started losing some weight, I said, this is weird. But, like, could it be stress? Because I know that I have
We have a
this.
stressful
and, like,
job.
we have a
Right,
stressful
yeah.
job. So, learning the symptoms, and again, just being like very aware of them. And again, like I have doctors too who are like, okay, you don't have to wait for every 3 months to like message me if you're having something, see me, like message me or something. So like if you feel anything off, and especially if it lasts for more than like 2 weeks, just like I think we as women get busy, and we heard that
sure.
a lot during
Oh,
the
yes.
pandemic of people like putting off appointments. Like just don't put them off, because that's how it gets worse.
Yep. Carlene, I've been on.
I know.
I've been
I'm
on her
bad at it.
case.
Yeah, Jane's on me. I do push off appointments, and I don't need to do that. So
Yeah.
I need to be, I need to be better about that.
It's hard because
It's
again,
hard.
like
Life,
doctors.
life gets in the way.
Life gets in
Yeah.
the way, schedules change, this, that, and the other.
Right.
You know.
Yeah, again, like my appointment yesterday was supposed to be Monday, and they were like, she's gonna be out of town, so you have to come. And I was like, all right, like, but I was like, I can't. Thankfully, like, I didn't have anything yesterday, but even if I did, like, that's not what I'm
Can't
gonna
miss
put off
it.
anymore.
Yeah.
Like that, they're so important to me. I will do anything and everything to
Right.
just make my appointments.
Yeah, absolutely. Yeah, as you should. Learning, it's not a lesson learned, but it's like knowing now.
Yeah.
Yeah, again,
Health
the
is-
knowledge. The
yeah.
knowledge is so
I'll
important.
say even because she's been through this, like I have a bit more forward of like, all right, I do need to make this appointment. I need to make it. I don't need to move it and everything. Just
Yeah.
because
I mean,
I've been
and we
around
talked
her.
earlier, we're aging every day.
Not to be a downer, but we are aging every day.
And then, and there are
Yeah.
wonderful things about aging. I'll tell you that.
Sure.
But you got to stay on top of some things. All right.
Yes. And again, like that's what was hard too, is like the doctor's like, well, you're so young, like it can't be cancer, but like
True.
it can be.
But it can
And
be.
again, like
And
we are
true.
getting older. Like yes, we're not old, but
Right.
it still can be.
Yeah.
Yep.
Unfortunately.
Spencer Collins.